Hello, everyone. Welcome back to another session of our NCLEX review session. We are on day 43 of the 90 days, and we are tackling a variety of nursing topics with focus on medical surgical nursing concepts for now. And we really want you to explore with the comprehensive NCLEX review that we are offering at our website at Stancoast NCLEXcoaching.com, where you can access over 3,000 NCLEX-style questions and 10 hours of animated videos for your study. And we really want to boost your confidence with all the resources that we have. So again, we are inviting you to check our website at www.stancoastNCLEXcoaching.com to learn more. And you can also check the description box below in order for you to know more about our program. Now, we really welcome your insights, your thoughts, your questions, and also your comments. So please put in your comments below, and don't forget to subscribe, to like this video, and also share this video with your friends. And today we will be talking on the sickle cell anemia. Hello, for those who just came into the classroom, welcome to our session today. We will be discussing about the sickle cell anemia. And so let's go right ahead into the topic. So what is this disorder? Well, basically this is a problem that is a genetic in nature. It runs in families, and it can happen when a person inherits two genes for the sickle cell hemoglobin, which is the HBS. Okay, again, we're talking about the sickle cell anemia today, and this is a genetic condition wherein the person will inherit two genes for the sickle hemoglobin, which is the HBS gene, all right? So if the person has that sickle cell anemia, well, they really have that symptom, okay? They will have issues all throughout their life because of this disorder. But if we are talking about sickle cell trait, they will only be carrying the disease. They will not be manifesting the symptoms. Now, let's talk about how this sickle cell anemia works. Well, normally our red blood cells have a protein, we call it hemoglobin A. Right? And this is responsible in carrying the oxygen throughout the body. But in the sickle cell anemia, this hemoglobin A is actually replaced by the abnormal hemoglobin, which is the HBS. And this change can happen because of a small alteration in the gene that actually makes the hemoglobin, and where a substance called valine is actually swapped for the glutamic acid. And what happens exactly is when the person with the sickle cell anemia don't get enough oxygen, or let's say when they get dehydrated, or when they get sick, or maybe they are stressed, well, what's going to happen is that the hemoglobin S molecules, they can stick together and they will form those long rods inside the red blood cells. And these rods will cause the cells to become stiff, and they will have that sickle shaped instead of being soft and round. And the sickle cells will now stick together, and they can block the blood flow in the small blood vessels, which can really lead to the pain and also damage in the different parts of the body. Now, when we're talking about the sickle cell trait, like I've said earlier, this is totally different from the sickle cell anemia, because with the trait, the person only inherits one abnormal hemoglobin gene. Okay, please take note about the inheritance here. With the sickle cell trait, the person is only inheriting one abnormal HBS gene. Here we go. Well, in comparison with the person with the sickle cell anemia, they are inheriting two defective genes. But here in the sickle cell trait, they're only going to inherit the one defective gene. Now, if you're going to ask, how common is this? Well, The sickle cell trait actually is pretty common, and this is occurring in about 1 in 12 people of African American, or let's say Italian or Greek or Middle Eastern descent. And yeah, I've taken care of people with sickle cell disease way back when I was still working at the bedside. And it can really affect the person. They can manifest so many symptoms. But here, when we are talking about the sickle cell trait, okay, then the person possibly can live normal, healthy lives. They don't even know that they have it unless they get tested. However, the person with a sickle cell trait, they can pass the gene to their children. All right, hello everyone. For those who just came into our classroom, we are on day 43 of the 90 days, and we are encouraging you to enroll into our program. Okay, now what about the prognosis here? Well, the life expectancy of the sickle cell anemia actually is kind of reduced, and in the US, the average life expectancy is about 58 years old. Okay, that is the median age in the US for those with a sickle disease. Okay, we're talking about the SCD. Now, what makes the condition worse, especially with the sickle cell disease? Well, they probably would go back to the hospital more often. They will end up with so many serious problems, maybe acute chest syndrome, which is like a pneumonia. And that's pretty much the reason why they are going to have frequent visits if they're not very compliant to the treatment. And they're going to need so many things as far as pain control, hydration because of the crisis, right? And so, again, we're going to need to really identify these precipitating factors in order for us to carefully manage this patient. Now, let's talk about the common causes of death in this patient. Sorry about that. But the common causes will actually include the following. Maybe those stressful conditions or situations. They're probably going to be exposed to some infections that would really precipitate the problem. Or they probably have some kind of stressful environment, which can really lead to that problem as well. So let's go into that precipitating factors. One of those will be exposure to cold temperatures, also high altitudes, and this can really cause this problem to occur. So let's talk about the high altitudes here. Well, we know that when the person is in that specific location in a higher altitude, well, we know that the air has less oxygen. Okay, less O2, which can really exacerbate the stickling and also the clumping of those red blood cells because of the oxygen availability. Now, the next one is cold temperatures. Well, we know that this can lead to vasoconstriction, right? And this can also reduce the blood flow to the certain areas, and this can increase the likelihood of the sickle cell clumping and also the blockage. All right, don't forget about the vasoconstrictive effect of the cold temperature. There's also the fever. So even the fever can become an emergency for this person. Okay, so this is going to be an emergent condition, especially in a patient with the sickle cell disease, because this can increase the patient's metabolic rate and also their oxygen demand. It can also lead to increasing sickling of the red blood cells. Now, another is infection, which will also lead to an emergent situation. This can trigger the body's immune system response, and it can lead into inflammation, and it will also worsen the sickle cell crisis. And it can promote the clumping of the sickle red blood cells as well in the bloodstream, of course, in the tiny circulation, right? And dehydration is another one wherein the person's blood will become more concentrated, and this can increase the likelihood of the sickle cell clumping. Now, another is insufficient oxygen, wherein the reduced oxygen level in the blood, let's say in the case of a lung disease, maybe a pneumonia, or any kind of bacterial infection, can also promote the sickling of the red blood cells. And the same thing with the emotional and physical stress. This will also trigger the release of the hormones that can affect the blood flow, and will also increase the likelihood of the sickle cell clumping. Okay. Now, let's talk about the inheritance about the sickle cell disease. So we will be looking into this photograph about how the person can potentially get the sickle cell disease. Hang on a sec. Let me just put this away. Now, you're seeing a picture here with the parents, and the father doesn't have any trait. So not carrying the sickle cell disease trait. However, you see the mother here carrying the trait, and considering that the mother is the carrier, right? So the mother is the carrier. We have here our father that is non-carrier. So what do you think can happen to the offsprings here? So you see here on the left side where the son is not inheriting any of the trait, not even getting one defective gene or not getting two of the defective genes. So here the child, the first son, actually inherits the normal hemoglobin from both parents. And so this child will not manifest any trait, or not even manifestations, no trait at all. So he is free from getting of that defective gene, okay? Because he got the normal gene coming from the mother, and also a gene coming from the father and the mother, I should say. Now, why is this happening? Well, this is because the sickle cell disease will require at least one abnormal hemoglobin gene, which is the HBS. But here, he is lucky that he did not inherit any of the defective gene. Okay. Now, talking about son number 2. Son number 1, we got son number 2. So here, the son will inherit normal hemoglobin gene from the father, okay? However, he is inheriting one abnormal gene from the mother. And so he is going to be a carrier. He inherited the sickle cell trait, okay? And this means that he can carry one normal hemoglobin gene, which is the HbA, and also one abnormal hemoglobin gene, which is the HbS. And this will not really cause any symptoms of the sickle cell disease, but he can pass the genes into his offspring, possibly. Now, talking about the daughter here, the first daughter, we'll just call her the first daughter here. And so this daughter is fortunate that she's actually inheriting the good gene from both parents, okay? So similar to son number 1, the daughter 1 will not manifest any symptom, will not also be a carrier, because again, she got the normal genes from each parent. Now, talking about daughter number 2 here. Daughter number 2. And look at this. She got the good gene from the father. However, she inherited the bad gene from the mother. And so she's going to actually gonna inherit the sickle cell trait. And this simply means that she carries one normal hemoglobin gene and one abnormal hemoglobin gene. And so she will be able to pass one trait to her offspring if she's gonna bear children, but she will not display any symptoms herself, okay? So we have son number one, daughter number one. They are not inheriting any of the genes. We have son number two and daughter number two. They're only inheriting at least one defective gene from the mother. And so they're not going to be manifesting any signs and symptoms. Now, taking a look into another variation here, wherein both the parents are actually carriers. So our father this time is a carrier. The mother is also a carrier of the defective gene. Now, let's take a look into son number one. Let me just label this ahead of time. Son number two, daughter one. We also have daughter two. So let's talk about the son one. Well, in this scenario, the son is inheriting one normal hemoglobin gene from both parents. So he inherited the normal hemoglobin from both parents. So let's just label that as normal hemoglobins from both parents, HbAA. So here, he doesn't have any sickle cell disease trait and also no disease because he did not inherit any abnormal hemoglobin gene. Now let's talk about son number two. Well, unfortunately, the son probably got one normal hemoglobin gene from either one of the parents. It's shaded blue right here. So that blue shade right here represents that he got at least he got at least one normal hemoglobin from either of the parents. However, he also got one abnormal hemoglobin gene from either of the parents. So this person will have sickle cell trait. So this person will only be a carrier, okay? He will not manifest any of the signs and symptoms of the sickle cell disease, okay? So again, he will only be a carrier. Now, the same thing will happen with daughter number one. So daughter number one inherited one normal hemoglobin gene from one of the parents, HbA, and also inheriting one defective hemoglobin gene from one of the parents, HbS. And the same thing with the second son. She's going to be a carrier, but will not manifest any signs and symptoms of sickle cell disease, but she can pass this on to her offspring. Now let's talk about daughter number two. And you see here that she is highlighted as red. So it simply means that she inherited two abnormal hemoglobin genes from the father and also from the mother. So this is going to be represented by HbS. Two S's because she got one defective gene from the father and also one defective gene from the mother. And so at this point, this woman, this lady, this girl will actually manifest the sickle cell anemia. She will be carrying the symptoms in her lifetime. And so if she's not going to be able to manage her condition pretty well, then she's going to be frequently going in and out of the hospitals in order to treat the life-threatening conditions. So I hope that you're able to capture the concept about the sickle cell disease, because this is really going to be important for you to recall, especially when you're going to take the exercises in the next few slides. Okay, so when the parents are both carriers, then there is going to be a 50-50 chance for that offspring to get the sickle cell trait. Okay, and there is also a chance that one of the offsprings will develop the sickle cell disease. However, if just one parent has that sickle cell trait while the other one doesn't have, then there's only about 50-50 chance that the children will possibly get the trait, but none of them will ever manifest the disease. Okay, So let's move forward here with the assessment findings in a person with the sickle cell disease. And we're talking now about the anemia, of course. You won't have the sickle cell disease if there is no if there is no sickle cell anemia. Well, this is already a manifestation, right? So the person with the sickle cell trait will never manifest anemia. So we will be talking about the manifestations here, especially when the problem is becoming chronic. So when the person has this kind of hemolytic anemia caused by the clumping of the red blood cells will end up hemolyzing. So the lifespan is shorter. It won't be able to function normally. And the person here with the anemia will have that pallor. Well, of course, if there is a decrease in the hemoglobin, the red blood cells, the person will look pale. And in severe cases or worst case, they're going to end up with a jaundice because of the increased breakdown in the red blood cells. Okay. Breakdown of RBCs, and this can lead to the yellowing of the skin and the eyes. There's also going to be gallstone disease, wherein the bilirubin will be increased because of the breakdown. This can lead to the gallstone formation. Gallstone formation. And there is also going to be delayed growth and maturation, especially in boys, because the chronic anemia can affect their growth and also their development. And also, this can lead to high output heart failure, because with a chronic anemia, this can also strain the heart. It can lead to this condition where the heart will pump more blood. Actually, it will work harder in order to compensate for the reduced oxygen carrying capacity. Now, we're also going to talk about the manifestations of the acute vaso-occlusive disease. Okay, so if there is that crisis with the rapid rate in the clumping of the red blood cells, then this can lead to the occlusion into the tiny circulations in the capillaries, in the joints. Then it can cause the pain. And of course, this can affect the bone structures, the bones, the joints, and also the abdomen. And it is caused by, again, the blockage of the red blood cells that are clumping together with that classic sickle appearance. They're going to block the blood flow, and this can cause so many problems. There will be a decrease in the oxygenation of the bone structure and also the muscle tissue. In some cases, this can lead to the bone infarction itself. So the person will be in severe pain because of the blocked blood flow going into the bone structure. And this is no joke, guys. I've taken care of a patient with the sickle cell crisis. They're in a lot of pain, and you really need to be on top of your game, especially in the pain control, especially when they're in this crisis. And the patient, especially in children, they're going to end up with this hand-foot syndrome, or known as the dactylitis, which is basically the swelling of the hands and the feet, which is very painful. Let me just write that down. Painful swelling of the hands and feet. And this is an early sign in infants. Early sign in infants. And in some cases, the person might end up with acute chest syndrome, which is basically a severe chest pain. They're going to end up with fever, and they're going to have difficulty of breathing. And this will cause them to be hospitalized, requiring immediate attention. So they're going to have that chest pain. There's also shortness of breath, and also fever. That's all about the acute chest syndrome. Another manifestation in the acute vaso-occlusion, there's going to be infarction of the spleen. And the reason for that, it's because of the blockage of the blood flow to the spleen, which will lead to the damage and also an increasing risk of infection. Okay, the blood flow blockage can lead to that infarction. Now, for the man, this can lead to painful, prolonged erection due to the blocked blood flow in the penis. So priapism is a manifestation of the vaso-occlusive crisis. Again, this is caused by the blocked blood flow into the penis, and also it will affect the kidney structure, especially the papillary. Now, what is going on inside the kidney, especially in the vaso-occlusive crisis? Well, the block in the blood flow to the kidneys can lead to that impairment in the kidney function. So they're going to end up possibly with renal failure. Now, another problem will be the occurrence of stroke. Well, if the occlusion is going on into the cerebral circulation, the arteries, the arterioles in the brain, then this can lead to the neurological deficits. They're going to end up possibly with acute stroke. Now, the patient will also lead to developing the myocardial infarction if the blockage is going to affect the coronary arteries. And a vascular necrosis is basically the death to the bone tissue. Death to the bone tissue. And again, the reason for that is the blockage of that blood flow into the bone structure. And the vascular necrosis is often affecting the hips and also the shoulders. So this is a common complaint in those patients having the sickle cell crisis. They're going to affect the hips and the shoulders, and this is where they're usually going to complain of that pain. Okay, hips and shoulders. Maybe in some cases it can also lead into the pain into the knees area and also the other joints, but most often the vascular necrosis will affect the hips and the shoulders. Now we're going to talk about the manifestations of the sickle cell anemia, especially in a chronic vaso-occlusion. So what are you going to anticipate seeing into this patient? Well, the person will end up with chronic lower extremity ulcers, and because of the poor healing of the leg wounds, okay? Poor healing of leg wounds because of the poor blood supply. A simple wound can develop into an ulcer. Now, the patient can also manifest some eye complications, and listed here, it can lead to retinal infarcts. It can also cause hemorrhage into the vitreous humor. There's also retinal detachment. Again, the reason for that is because of the prolonged, or let's say chronicity of the vaso-occlusions. Now, another possible manifestation here will be the aplastic crisis, wherein the severe anemia is going to occur because of a sudden decrease in the red blood cell production. Sudden decrease in RBC production. So they're going to end up with that aplastic crisis. And of course, remember about that ongoing occlusion, poor blood supply into the bones, which are actually going to create or produce the red blood cells. So in turn, this can lead into an aplastic crisis, which will cause a sudden decrease in the red blood cells. Now, in some cases, there's also going to be infectious complications because of the problem with the spleen, as I have said earlier. This is what we refer to as the functional asplenia. Hang on a sec, let me put my pen. Functional asplenia. So basically, this is what we call as reduced spleen function. And this can predispose the patient to many infections, especially from an encapsulated type of bacteria. So they're going to be prone to any infections and also complications. Now let's talk about the diagnostic tests that will be useful in determining or establishing the diagnosis of sickle cell anemia. Well, of course, one of that is the complete blood count, and this is going to help identify the abnormalities in the blood. It can detect if there is anemia, and also with the sickle cell anemia, of course, there's going to be anemia, right? Yeah, you're going to expect that there is going to be a reduction in the count, especially the hemoglobin, hematocrit count. And in some cases, though, there might be some sort of elevation at some point. I'm not saying that it will be consistent, but at some point, the person might end up with some elevation of the red blood cells, but it will not last long. And the reason for that could be a compensatory response to the chronic anemia. So at some point, again, the patient might end up with elevation of the red blood cells, but it will only be temporary. And the reason for that is only to compensate for the chronic anemia. Now, another reason why there is anemia, because the person is prone to developing hemolysis, the breakdown of the red blood cells. Okay, hemolysis can lead to a shorter lifespan of the sickled red blood cells. Now we're going to talk about the peripheral blood smear. So this is another diagnostic test for the sickle cell disease, which will examine a sample of the blood under the microscope in order to assess the shape and structure of the red blood cells. Shape and structure of the red blood cells will be checked here. And so in a case of the sickle cell disease, the peripheral blood smear will reflect that sickle-shaped red blood cells. Sickle-shaped RBC. So it will have that kind of curved formation, which will be easy to clump together with the other red blood cells in the circulation, which is pretty much an abnormal shape, right? Because normally the red blood cells actually is a biconcave shape, and it's very flexible, and it will not really cause clumping together in a normal condition. But our patient with a sickle cell disease will have that classic, like a quarter, or not quarter, yeah, it's like a quarter shaped moon. There's that sickle shape, okay? Now, let's talk about the hemoglobin electrophoresis. So what is this testing? Well, this is going to separate the different types of hemoglobin. So this is a test that will separate, or this separates different types of hemoglobin. Let me say that again. The hemoglobin electrophoresis is a diagnostic test that will allow the separation of the different types of hemoglobin based on their electrical charge. And so what will be seen in a patient with the SCD, or the sickle cell disease? Well, this person with the SCD will have that hemoglobin S, okay? The diseased hemoglobin, which is predominant in the sickle cell disease, okay? And this is going to be elevated in this person. The count will be elevated in a person with the sickle cell disease. Now, let's talk about the genetic testing for the hemoglobin B gene mutation. So what is this testing? This is going to detect the specific mutation of the hemoglobin B gene, which actually will encode the beta globin chain of the hemoglobin. And so the person, especially during their childhood, or let's say infancy, This is going to be tested to confirm the presence of mutation. Confirm the presence of mutation. And also, this will identify the carrier. All right, so don't forget about the genetic testing. And also, we have the sickle dex, or we call that one as a sickle turbidity test. Let me just erase this real quick. Sickle dex, or the sickle turbidity test, and this is a frequent diagnostic test that can be easily done and will have a result within 3 minutes. So it's basically going to collect a very tiny sample of the blood, okay? So within 3 minutes, this can yield accurate results, okay? So this will identify that the person has that sickle cell disease, all right? Sickle dex, sickle turbidity testing. Now, this time we're going to talk about the treatment of the sickle cell disease. Well, how are we going to do our approach here? Well, if we are going to do the prevention of the crisis, then there's so many, okay? One of those will be to advise our patient, make sure that we are educating our patient to avoid high altitudes, as we know that in higher altitudes there is lower oxygen levels. Low O2 levels, and this can predispose to sickle, or precipitate rather, sickle cell crisis. And another is to maintain fluid intake. This is very important, guys, because dehydration can trigger the crisis. Dehydration can also precipitate the crisis. Now, another is the treating or the treatment of infections promptly. This is very important, especially in a case wherein the person will end up with a fever. Like I have said earlier, this is a medical emergency. I'm not kidding. This is a medical emergency. For us normal people, this isn't an emergency. But for those people with a sickle cell disease, fever is a medical emergency because this can lead to the crisis. So when any kind of infection, for example, if they probably would feel like they're fatigued, maybe they just feel so exhausted, maybe they're just like feeling warm, that is a medical emergency, guys. We really need to investigate further, assess this patient carefully, and notify the medical provider, because this is something that can lead to the crisis. We need to promptly treat any of their infection with antibiotics to prevent the complication. All right. Now, talking about the prevention of infections, one of the preventions here will be the getting the Streptococcus pneumonia vaccine. Let me erase this right here. Haemophilus influenza, or the Neisseria meningitidis. And so these are important vaccinations that will prevent any future infections that can cause severe manifestations in this patients with the sickle cell disease. Now, for children, especially less than 5 years old, they're gonna be getting prophylactic penicillin, especially that they are prone to getting the infections. And for the adults, we will encounter this medication we call as hydroxyurea. Okay, let me just shift my pen. So the hydroxyurea is what we call as a disease modifying medication. And the hydroxyurea can also be used as an anti-cancer, anti-metabolite. But in a case with a sickle cell disease, this is going to be used as a disease modifying medication, wherein it can increase the fetal hemoglobin. Again, the action of this drug is to increase fetal hemoglobin. Even if we are already adults, it can increase the fetal hemoglobin, which basically will reduce the sickling of the red blood cells and will also prevent the vaso-occlusive events. All right. Now, we need to also manage the anemia of the patient. We're going to administer folic acid supplementation in order to promote the production of the red blood cells. And this is going to be a common supplementation in people with the sickle cell disease as well. Now, part of the management here would be to administer blood transfusions as needed. Blood transfusion. When the patient is really in a severe anemia, or let's say there is symptoms of severe anemia, then we definitely need to administer the blood product in order to prevent complications like stroke or acute chest syndrome. And so the decision for the blood transfusion basically is based on the clinical need rather than just the hemoglobin levels. Okay. Again, the administration of the blood transfusion, let's say packed red blood cells, can be based on the clinical need rather than just the hemoglobin levels. Well, of course, the medical provider will have to look into the hemoglobin as well. But again, the person's or the patient's overall clinical manifestations would also be one of the basis. Okay. Now, talking about the management of the pain during the crisis, this is very important, guys. Let me clear this. During the crisis, this is where the action really would happen. We are going to hydrate the patient. If they cannot tolerate taking the oral fluids, then we are going to administer IV fluids. Hydration, either PO or IV. And this is going to, possibly they're going to tolerate the PO during the mild episodes, but let's say it's moderate to severe, then IV administration of the fluids will be helpful. Okay. Now, for the pain control, what do we need to do? Well, in some cases, they probably would respond to the NSAID. But if their pain becomes severe, then we're going to be giving them the opioid medication, such as morphine. Okay. And it's no joke, especially when they're in a lot of pain. Sometimes they are probably not responsive to the morphine anymore. I've dealt with patients that had to transition from morphine sulfate IV into dilaudid hydromorphone rather, because they had developed the tolerance for the frequent use of these medications. They've been frequent flyers, and so they're no longer responsive to like the regular dose of morphine. And we really need to take into consideration the patient's pain level, and also to take it seriously, because I mean, the pain itself is just excruciating. Another intervention here or treatment that can be beneficial is the bone marrow transplantation in order to cure the sickle cell disease. It cures sickle cell disease. Okay. However, this is not commonly performed. Okay. Again, not commonly performed because, let me just write it here, not commonly performed. And the reason for that is because of the risks that are involved and also the challenge of finding a suitable donor match. So the challenge is about the risk involved in the procedure and also finding a suitable donor. Those are the challenges in the bone marrow transplantation. The risks in the procedure itself and the lack of the donor, finding a suitable donor. Now again, let me summarize this slide right now. When we are treating the patient with a sickle cell disease, our focus here is on the prevention of the crisis. Also, we're going to have to manage their manifestations or the signs and symptoms. We're going to have to prevent infections, and we're also going to administer that medication we call hydroxyurea, which is the disease-modifying drug, which can increase fetal hemoglobin and will prevent the occurrence of the crisis, the vaso-occlusive crisis. And we're also going to manage the patient's anemia if they have the current anemia, of course, managing their pain during the occlusive crisis. And lastly, we have the bone marrow transplantation. Now, I hope that you're able to capture all those concepts because this will be needed in our exercises. And hopefully you will be able to apply these in your NCLEX. Now, let's talk about the nursing actions. What are we supposed to do here? Well, most often when you are going to be working in the medical surgical unit, well, of course, our patient is in acute sickle cell crisis, right? And so what you're going to do here is to basically do your diligent assessment and everything. But with acute case of the vaso-occlusive crisis, our role here is to really control the pain. That is topmost, aside from administering or let's say providing hydration. So pain management, hydration, and oxygenation. So these are top priorities in the treatment of the vaso-occlusive crisis. Hydration, oxygenation, and pain management. Like I've said earlier, for the pain management, maybe the patient will be responsive to the NSAID, or maybe in severe cases, they might need a higher pain medication, maybe morphine, dilaudid, maybe fentanyl, IV. And of course, the hydration is very important in order to promptly address the dehydration, and which will lessen the sickling of the red blood cells. And this is very important. And of course, the oxygenation will be high priority in order to improve the oxygenation into the body tissues. Now, another is the assessment and monitoring of our patient. We need to carefully check the patient's vital signs, everything, all those: blood pressure, heart rate, saturation, respirations, pain level, everything. And also we're going to have to monitor their urinary output as well. We need to check their renal function, urine output. Okay, this is going to detect any signs of renal complications, maybe necrosis of the kidney. So take a look into the intake and output, and also follow the laboratory results. Now, part of the care here would be the comfort measures, and this is going to really assist the patient in managing their pain. So one of the comfort measures here will be frequent positioning, repositioning, I should say, and also pain relief. And we're going to have to avoid the application of extreme temperatures. Avoid application of extreme temperatures. Like we've said earlier about the cold temperature, it can also complicate the vaso-occlusion, right? We can provide them with heat, right? You can apply heat, but not extremely hot. Apply heat to joints for short periods. And this is to treat the painful sensation in the joint areas. Again, this will be for a limited time. You can do this several times a day, probably 4 to 6 times a day to your patient, but not extensive, and it's not extremely hot. All right, please be careful about the application of heat. Now, we're also going to have to provide the patient with relaxation techniques, maybe distraction, deep breathing exercises. For the patient, long-term care is very important, guys. Long-term care and prevention. We're going to have to talk in depth with the patient about the nature of the sickle cell disease. We're going to have to talk about the triggers for the crisis, the precipitating factors, I should say. so they can avoid this condition. Precipitating factors, avoidance of precipitating factors. We're also going to have to talk about signs of complications. Signs of complications. And we're also going to guide them with self-care strategies, hydration, avoiding extreme temperatures, recognizing early signs of complications. So those are the things that we're going to include in the teaching. Now, part of the care will be the routine health maintenance. So we definitely need to educate our patient about being compliant to follow-up appointments. Compliance with follow-up appointments. So at least they will have blood work to be done. And of course, there will be much more of comprehensive care and monitoring. And they need to be compliant with the medications such as the hydroxyurea. And the reason for that is because the hydroxyurea will require frequent blood testing. Okay. And also, we're going to need to educate the patient about infection prevention. We have to educate them about the needed immunizations, especially the pneumococcal influenza vaccines. We're also going to teach them about the proper hygiene technique, infection control measures. And lastly, we're going to have to deal with their emotions, psychological aspect. So we need to support them with, let's say, counseling. Maybe we're going to have to support them by referring them to the resources in the community, maybe support groups, in order that they can have some kind of like peer networking. And yeah, they will have that sense of community as well. So they will be able to at least converse with these patients, how they're able to properly manage their problems. Now, nutritional support is very important, guys, to ensure that our patient will be taking good amount of the nutrition. And also, we are going to have to address any kind of deficiencies in their nutrition promptly. So let's go right ahead into our test question. This is going to be our first question of the day. So the test item stated, a nurse taking care of John, a 28-year-old male with sickle cell disease, admitted to the medical surgical floor with complaints of severe pain in his legs and chest. John reports that he has been experiencing fatigue, shortness of breath, and frequent infections. His medical history includes multiple hospitalizations for vaso-occlusive crisis. As his nurse, you need to identify the clinical manifestations associated with sickle cell disease to provide appropriate care. Now, your role this time is to determine whether the following manifestations are expected or not expected in the patient with the sickle cell disease. So you need to indicate your answer in the table below, whether it is expected or not expected. So here we go. We have one manifestation, severe pain in the legs and chest. What do you think about that? Severe pain in the legs and chest. So this is a general question, all right? Determine whether the following manifestations are expected or not expected in patients with sickle cell disease. It's not just referring to the patient in the scenario. This is a general question. Now, severe pain in the chest and the legs. This is expected in sickle cell disease because of the vaso-occlusive crisis. So this is expected. What about the fatigue? Well, what can you associate with the fatigue? Well, the person will end up with chronic hemolytic anemia. With that chronic anemia, because of the breakdown of the sickle cells, this can reduce the lifespan of the red blood cells, right? And it will reduce the oxygen delivery to the body tissues. So they're going to end up with exhaustion and fatigue. That will be expected. What about polycythemia? Well, I said something about the temporary increase of the red blood cells, but it's not going to be constant. It's not going to be constant. And so polycythemia is not really expected. All right. We're going to mark that as not expected because the polycythemia that we said earlier, that I talked about earlier, is not constant. It is only a compensation, but again, it's not going to be a consistent finding in every patient. All right. So it will only occur in certain conditions. So polycythemia, not consistent in every patient with SCD. Now the jaundice, what is the jaundice? This is the yellowing of the skin, right? The sclera, other mucosal lining in the body. So you will note that yellowing, right? And the reason for that is because of the rapid breakdown of the red blood cells. Rapid breakdown of RBCs, and it will accumulate in the bloodstream. Okay, so the breakdown of the red blood cells will release the bilirubin. Releases bilirubin. And when this is accumulating in the bloodstream, this will now cause the jaundice, yellowing of the skin. Release bilirubin in the blood. So that's why they are going to have that yellowish skin color, and also in the eyes. All right, let's talk about frequent infections. What is that? Frequent infections. Well, we know that our SCD patients are more susceptible to the infections, especially for the encapsulated bacteria such as the Streptococcus pneumoniae. Streptococcus pneumoniae, which is an encapsulated type of bacteria. All right. So our patient here is gonna be prone to developing functional asplenia. Functional asplenia, which I mentioned earlier. This is going to predispose the patient to frequency in the infections. And of course, this is caused by the repeated infarctions in the spleen. And the reason for that is because of the occlusion in the blood supply to the spleen. And so the patient will end up with common Streptococcus pneumoniae infection. Let me clear this because I got some more stuff to write. We're going to talk about the hypercalcemia. What do you think about hypercalcemia? Elevated calcium level in the bloodstream. Well, to tell you guys, this is not expected. Not a typical manifestation of SCD. Not a manifestation in sickle cell disease. Okay, it doesn't affect calcium. Does not affect calcium balance directly. Now, what about hematuria? Presence of blood in the urine. What do you think about that? Well, we know that the kidneys can potentially damage the disease can potentially damage the kidneys, I should say. But again, hematuria will not be a common primary manifestation. Okay, not a common manifestation, even though the SCD can lead to kidney problems, but it will not lead to hematuria. Now, what about splenomegaly? What did I say earlier about the spleen itself? Remember that the patient with SCD, they're going to have that infarction, right, to that organ. But in most adults with SCD, they have actually a small fibrotic spleen, okay, because of the repeated ischemia and infarction. There will not be splenomegaly. However, they're going to end up with small fibrotic spleen. So this is wrong. Instead, they're going to have small fibrotic spleen because of the poor blood supply, right? And this is going to be called as an atrophy of the spleen. No enlargement. No enlargement. So this is going to be not expected. What about the bradycardia? Take a look into the bradycardia, guys. Do you think that the person with SCD will develop bradycardia? No, it will not be expected. Let me erase this. There is no bradycardia in SCD. But what's going to happen rather is that they're going to have rapid heart rate. They will tend to be more having the tachycardia. And again, the reason for the tachycardia is a compensatory mechanism because of the anemia. Compensatory mechanism due to the anemia. So the body will tell the heart, hey, we really want you to give us more blood. We want you to give us more oxygen so we are not going to die. And so the body will tell that to the heart, and so the heart will end up with creating much more rapid heart rate. Now, talking about the shortness of breath, what do you think about the shortness of breath, guys? The anemia in the sickle cell disease will lead to the reduction in the oxygen carrying capacity of the blood. And so our patient will develop the shortness of breath. This is going to be expected, okay? Due to what? Because of the decreased oxygen carrying capacity of the red blood cells, okay? So we are going to put that as expected. So let's review our answers here, guys. Let me remove this. So we will summarize our answers to make sure that you're understanding the different manifestations. Again, severe pain in the legs and chest. Yes, it is expected. What about fatigue? Because of the chronic hemolytic anemia, it's expected. Polycythemia, like I've said earlier, it's not consistent on every patient with the SCD. Not consistent on all cases. So the polycythemia is going to be not expected. What about the jaundice? Yeah, the jaundice is caused by the rapid degradation, destruction of the red blood cells. The bilirubin will be increased in the bloodstream, and this will give that yellowish color of the skin and also the sclera. What about frequent infections? Remember about the what do you call this? Asplenia, wherein the person will be prone to developing those bacterial infection, especially the Streptococcus pneumoniae encapsulated type of bacteria. So shortness of breath, yes, expected. So how many got the correct answers here? How many of you guys? Okay, I hope that you're at least getting 75% of the items here. Now let's move forward to the next question here. A nurse in the medical surgical unit is caring for a new patient, a 25-year-old male who presents with symptoms suggesting sickle cell disease. The patient did not report any significant medical history. To confirm the diagnosis, a series of diagnostic tests are ordered. Again, the situation stated, A nurse in the medical surgical unit is caring for a new patient, a 25-year-old male who presents with symptoms suggesting sickle cell disease. The patient did not report any significant medical history. To confirm the diagnosis, a series of diagnostic tests are ordered. Which of the following diagnostic tests are required to establish the diagnosis of sickle cell disease? Indicate whether each test is expected or not expected. Well, good job, guys. 8 out of 10, 7 out of 10, 9 out of 10, 7 out of 10. Very good. So let's talk about the hemoglobin electrophoresis. What did we talk about earlier about the hemoglobin electrophoresis? Remember that this is a diagnostic tool, diagnostic procedure wherein the lab personnel, the lab scientists will actually have that opportunity to separate those different hemoglobins. So they're going to be able to identify the disease type of hemoglobin, let's say the hemoglobin S, and they will be able to tell apart the abnormal and the normal hemoglobin. Yes, this is going to be a procedure or diagnostic test that will be indicated. Yeah, it's expected. What about complete blood count? It is a very common diagnostic test that can identify low hemoglobin, low hematocrit, low red blood cell. And so this can help in detecting the sickle cell disease as well. It will be one of the answers. What about number 3? Peripheral blood smear. And we've talked about the peripheral blood smear yesterday in our discussion about the anemia, right? About the iron deficiency anemia. And also, yeah, we talked about that yesterday. Now, this test will help visualize the characteristic sickle-shaped red blood cell. So this is going to be a useful diagnostic test. What about genetic testing for the hemoglobin B gene mutation? Yeah, remember? It will confirm the presence of the mutation. Confirms the presence of mutation. Genetic testing will be indicated. Again, guys, this is a patient that did not report any significant medical history. He's a lucky one. Maybe he's just not well versed with the medical history, but a 25-year-old, yeah, that's kind of odd that maybe he's just denying any history, maybe not giving full disclosure of the medical history, and that's why, yeah, we need to test this person because he's not telling us anything. And so the genetic testing will be useful. What about the bone marrow biopsy? What do you think of bone marrow biopsy? Well, as I've said earlier, this is going to not typically required for the diagnosis. The bone marrow biopsy is actually not required. So let me just put it that way. Not routinely required. I was thinking about the bone transplant, but this is totally different. Bone marrow biopsy, not routinely required. All right. So this is going to be not indicated. All right. So the diagnosis of the sickle cell disease, SCD, can be diagnosed with less invasive test. So bone marrow biopsy is not required. All right. What about chest x-ray? Do you think that chest x-ray can help in the diagnosis of SCD? I know that this can really identify complications like chest syndrome, but it's not going to be used to help diagnose the SCD. So this is going to be not indicated. And again, the same thing with MRI of the brain. This can detect the complications such as stroke, but it's not going to be necessary in the diagnosis of the SCD as well. Not indicated. What about the erythrocyte sedimentation rate, which is basically an inflammatory marker? So this is not specific to the diagnosis, not specific in diagnosing SCD. So this is going to be not indicated as well. So how did you do in this test question? Did you get a total score of 8 out of 8? Okay. Let's move forward to the next test question here, number 3. A 25-year-old African-American male was admitted to the hospital with severe pain due to the sickle cell crisis. He has a history of frequent hospitalization for sickle cell crisis and requires close monitoring and pain management. When caring for John or this patient during a sickle cell crisis, which intervention is most critical for the nurse to prioritize? Very good, Mary. Is it 1, 6 over 8? Not bad, AJ Ike. 1, restricting John's oral and IV fluid intake. 2, assessing the effectiveness of opioid pain medication. 3, encouraging John to walk as much as possible. 4, educating John about a high protein, high calorie diet. Catherine had 8 out of 8. Wonderful. Congratulations. All right. Okay. Now I'm seeing that there are 49 people here. I thought there were only 3. Okay. Number 2 is Jet's answer, assessing the effectiveness of opioid pain medication. So let's reread the situation, guys. Let's reread. I know that I presented it earlier that those 2 are priorities about pain control and hydration, but on those 2, 1 is of a higher priority. I forgot to emphasize that, guys. But like I've said, those 2 are high priorities, but comparing the 2, there is much more of a higher priority comparing the 2. So the question stated, 52 people. I didn't know that I was thinking that there were only 3 people. That was odd. So what would be your goal here? It said, was admitted to the hospital with severe pain due to a sickle cell crisis. He has a history of frequent hospitalization for sickle cell crisis and requires close monitoring and pain management. When caring for John during a sickle cell crisis, which intervention is most critical for the nurse to prioritize? Well, of course, our issue here is pain, right? Severe pain. We need to address the severe pain in this patient with a sickle cell crisis. And what will be our critical nursing care for this patient? Well, let's try to eliminate the items first before we'll end up with the correct answer. 1, restricting John's oral and IV fluid intake. Are you supposed to restrict their fluid intake? No, we are not supposed to restrict. This is wrong. Do not restrict fluid intake. The fluids should be increased instead. Do not restrict the fluid. We need to reduce the viscosity, the thickness of the blood, which will prevent the occlusion, right? So we are going to administer IVF. If in such a case that they're not able to tolerate oral fluids, we need to administer IVF as ordered. We need to prevent further stickling of the red blood cells. What about number 2? Correct. Assessing the effectiveness of the pain medication, especially the opioid medication. That is the correct answer. We need to evaluate if the patient is getting pain control, which will prevent further complications. It will also promote his comfort. Okay. What about number 3? Encouraging John to walk as much as possible? No, especially in a crisis, our patient should not be encouraged to walk around because we need to decrease the body's energy needs. All right? This is wrong. Do not encourage. So the patient should have conservation energy. Conserve energy. All right? We're going to make sure that the body's energy is reduced this time. I mean, the consumption rather. Reduce consumption of energy. Okay, this is our goal. It will prevent further sickling. Prevents further sickling. All right. What about 4? Educating John about high protein, high calorie diet. We know that this is good intervention, right? But we are going to manage first the sickle cell crisis. This one does not address the crisis. Promote fluid intake for SCD. Siligi, Paulo, why are you laughing? Let me know, why are you laughing? So, again, our goal here is to assess the effectiveness of the opioid pain medication. That is our goal. Okay, what happened to here? Check. Okay, let's move on. Number 4. A 30-year-old woman of Mediterranean descent with sickle cell disease attends a follow-up appointment to discuss preventive measures for the sickle cell crisis. Which statement by Sarah, which is actually the patient, right? Sarah is a 25-year-old woman of Mediterranean descent with sickle cell disease, attends a follow-up appointment to discuss preventive measures for sickle cell crisis. Which statement by Sarah demonstrates a clear understanding of the nurse's education and in preventing the sickle cell crisis? So what statement or which statement? Oh, hang on a sec. This is an erroneous copy of the Word document. Let me just fix this really quick. We are on page 766. 766. Let me do a quick fix. Here we go. Which statement? I hope that I'm correcting the right one. Okay, hang tight. Let me correct that one. Okay, here we go. So that is item number 4. So let's go back to that question. Okay, question. A 30-year-old woman of Mediterranean descent with sickle cell disease attends a follow-up appointment to discuss the preventive measures for sickle cell crisis. Which statement by Sarah, the patient, demonstrate a clear understanding of the nurse's education on preventing sickle cell crisis? Is it 1, I should use home oxygen therapy regularly to prevent sickling? Or 2, there aren't any effective medications to prevent sickling? Or 3, I need to take continuous narcotics to prevent a crisis? And 4, getting an annual flu shot can reduce my risk of having a crisis. Right. So this patient is Sarah. Here we go. So take your pick. I'm seeing 4 from Virtuous Lady. I'm seeing 3 from Tiramaj. What will be your answer here, guys? So this is a patient attending a follow-up appointment to discuss preventive measures. Jet answered 4. Okay, let's read through the options here. What about number 1? Let's screen the answers. Home oxygen therapy. It said, hi, I should use home oxygen therapy regularly to prevent sickling. So, will the home oxygen therapy prevent the sickling? No, it doesn't. So we're going to mark this as a wrong option. Does not prevent sickling. So eliminating that one. Home O2 therapy will not prevent the sickle crisis. Now, number 2, there aren't any effective medications to prevent sickling. Well, that is a false statement because we have the hydroxyurea. False statement. It said there aren't any effective medications. Well, there is. That is a wrong answer. So we have the medication hydroxyurea. Okay. It will reduce the frequency of the sickle cell crisis. Reduces frequency of crisis by increasing the fetal hemoglobin. And that is the exact drug mechanism of this medication in adults even. It will increase the fetal hemoglobin, and this will be a preventive measure. What about 3? I need to take continuous narcotics to prevent a crisis. Well, it doesn't. The narcotics will not prevent. That's wrong. So getting an annual flu shot can reduce my risk of having a crisis is our answer. All right. We already emphasized that one earlier in our pre-exercise lecture. Okay. So those infections, especially like the flu, will be prevented by the annual flu shot as well. Now, again, our focus here is prevention. It's not curative. So take a look into the question. Don't get lost in the question. Our goal here is to prevent the occurrence of sickle cell crisis. So you're going to look for those interventions that will, or actions that will prevent the occurrence of the problem. Okay. Let's talk about number 5. A nurse in the med-surg unit is caring for a patient newly diagnosed with sickle cell disease. As part of the teaching plan in managing complications, various medical interventions are considered. It is essential to understand which treatments are appropriate for managing SCD and which are not. So here we go. We have our treatment items: hydroxyurea, 2 iron supplements, 3 blood transfusion, 4 bone marrow transplantation, 5 non-steroidal anti-inflammatory drugs, and 6 erythropoietin therapy. So I want you to indicate if they're indicated, or are they useful, or are they appropriate or not appropriate. All right, let's start on answering the test items here. 1, 2, 3, 4, 5. Okay, let's make sure we are filtering the answers here. Hydroxyurea, again, this is a preventive measure, right? It will prevent the crisis. Prevents future crisis. E, because there will be future. Multiple, so it will prevent. Okay, so this is indicated. What about iron supplements? Are we going to give them iron supplements? Well, guys, especially with the SCDs, remember about the hemolysis. When there is hemolysis, this can release the iron into the circulation and will lead into iron overload. So we are not going to give them iron supplement. This is not indicated. Okay. Why are they going to be overloaded as well? Because of a possible frequent blood transfusions. They are going to end up having that. So not indicated. No, this is contraindicated. They don't have iron deficiency anemia, guys. So it's not indicated. SCDs don't have, I'm pertaining to SCD patients, IDA. So they're not supposed to be taking the iron supplements. They're gonna get overloaded. We don't want that. Blood transfusion. Do you think that they're gonna benefit from blood transfusion? Of course. When they're gonna end up with a significant anemia, they need to have the blood transfusion to prevent risks or to reduce the risk of complications such as stroke. So make sure you have that in your care plan as well. What about number 4? Bone marrow transplantation. Bone marrow transplantation. We are talking about a general question here. As part of the teaching plan in managing complications, all right? This is a general question, guys, about the possibilities of different treatments that could be afforded, okay? And so what we're gonna do here, we're gonna include the bone marrow transplantation as a possible treatment. But like I said earlier, it is quite limited because of the risks involved and also the difficulty in finding a good match. But it's still indicated in this patient because we are asking about general medical interventions here. All right. What about non-steroidal anti-inflammatory? So the NSAIDs, are they indicated? Let me take a look. 5. Yeah, this is indicated, guys. This will be indicated for mild to moderate pain. All right. The NSAIDs will be effective in treating mild to moderate pain. What about erythropoietin therapy? What is this? Erythropoietin therapy. It is not going to be indicated, guys, because the erythropoietin therapy does not address the pathology of the sickle cell disease. It doesn't. There is no problem in the production of the red blood cells. So erythropoietin is not indicated. There is no issue in RBC production. In most cases, there isn't. The issue is the defective gene that will cause the red blood cells to have that sickle form, which will be, it has that tendency to develop into that clumping, right? The, what do you call this? Aggregation, or let's say the clumping of the red blood cells that can occlude the minute circulation. So the erythropoietin will not address the primary problem in the sickle cell disease. So we're gonna put that as a non-indicated. So I hope that you're getting at least 75% or 70%. So that's good. 5 out of 6. What about the others? Okay. All right, looks good. Looking good, guys. What about number 6? Let's take a look into this situation. So the question states, or the scenario, what is this? A nurse is taking care of Sarah A 30-year-old female with sickle cell disease who is admitted to the medical surgical unit for a vaso-occlusive crisis. During your shift, you discuss her treatment plan with her, including pain management, hydration, and the use of medications like hydroxyurea. To ensure she understands her treatment, you ask her to repeat some of the information back to you. Which of the following statements made by the patient indicate an understanding of her treatment for sickle cell disease? Select all that apply. So let's take a look on statement 1. I need to stay hydrated by drinking plenty of fluids to help prevent pain crisis. Well, yeah. Remember about the hydration that we are going to promote? This is a great statement from the patient. This is correct. What about number 2? I can stop taking hydroxyurea once I start feeling better and have fewer pain episodes. Incorrect. There is no need for this patient to stop taking the drug once they feel a bit better. No, they should be consistent in taking the medication as prescribed in order to reduce the frequency of the pain episodes. So this is wrong. I can stop. That is wrong. They should adhere to the therapy and also the prescription. Now, what about number 3, guys? Taking my folic acid supplements will help my body produce more healthy red blood cells. Yeah, we mentioned about that earlier, that folic acid can actually support the red blood cell production. It supports, I don't have enough space, folic acid supports red blood cell production. Okay, so our answer for that is going to be yes. It indicates understanding. What about number 4? If I experience severe pain, I should wait a few hours to see if it goes away before taking any pain medication. No. The patient in SCD should be managed they should promptly manage their pain in order to prevent increase in their pain levels and also to prevent the complications. Because if they're going to prolong, or let's say if they're going to delay the treatment, then this can really worsen the crisis as well. So I should wait is the wrong statement, or part of the statement here should be removed. That is a wrong statement right there. What about number 5? It's important to get regular blood transfusions to reduce the risk of complications like stroke. It's important to get regular blood transfusions to reduce the risk of complications like stroke. Now, this might seem a little bit odd that it says regular blood transfusions, but most often, guys, these SCD patients will actually need regular blood transfusions because of the hemolysis, right? So this is a correct statement. So yeah, it kind of appear odd that it said regular, but it's actually true. What about number 6? I should avoid getting vaccinated because vaccines can trigger a pain crisis. Is that correct? No, it doesn't reflect understanding, because what we have said earlier, the vaccinations are important in preventing the infections, which can possibly trigger the pain crisis. So we're going to remove that one. The word avoid makes it wrong. What about number 7? Using heat packs can help relieve the pain during a vaso-occlusive crisis. What did I say about the heat application? This can also be used in order to prevent, or it will not prevent, but alleviate, I should say, can relieve the pain during a vaso-occlusive crisis. This can improve the blood flow as well, and it can relax the muscles. Improves blood flow, relaxes the muscles? Well, of course, muscle relaxation and also vasodilation, right? So that has that therapeutic effect. Wonderful. 7 out of 10 or 7 out of 7. That's good, AGI. Improving better, huh? Now let's talk about another scenario. Question number 7. A 20-year-old African-American male is being discharged after treatment for a sickle cell disease or sickle cell crisis. What important advice should the nurse provide to Michael, who is the patient, during his discharge education to prevent future sickle cell crisis? What do you think would be that advice that will be important for this patient to prevent sickle cell crisis? Is it 1, take a daily multivitamin with iron? You think that can help? Let's screen that one. Number 1, iron supplementation. Remember what I said about the hemolysis that can happen in a patient with SCD? With that, there is going to be increased iron in the circulation and also in the body. So they're not going to need the iron supplementation. This is contraindicated. Okay, so this can lead to iron overload. So statement number 1 can lead to iron overload. What about number 2? Limit fluid intake to 2 to 3 quarts per day. 2 to 3 quarts per day, that is going to cause the vaso-occlusive crisis. So we better not do that. We want to make sure that our patient is adequately hydrated. We want to make sure that we are okay, limit is the word that's making it erroneous. Instead, we need to prevent hemoconcentration. We don't want hemoconcentration because of the higher risk of the clumping between the red blood cells. We want to dilute their blood to prevent sickling. What about number 3? Avoid crowded places as much as possible. Do you think that this is a good advice? Avoid crowded places as much as possible. As we know, guys, that our patient has higher risk of infection. Expected high risk for infection. So our patient should be advised in avoiding the crowded places that will safeguard them. Okay, we should not let them do that. So this is our correct answer. What about restrict caffeine intake or intake to 2 beverages per day? There is no such recommendation, not indicated. So this is wrong. So our correct answer here is number 3. Infection and flu. All right, very good. I'm seeing all 3s. That's great. Let's have number 8. James and Lisa, an African-American couple engaged to be married, recently found out through genetic testing that both are carriers of the sickle cell gene. What should the nurse consider when planning follow-up counseling for James and Lisa regarding their genetic testing results? 1, their child has a 25% chance of having sickle cell disease. 2, they both have a higher risk of developing sickle cell disease later in life. 3, each of their children has a 50% risk of developing sickle cell disease. 4, the risk for their children depends on a mix of genetics and lifestyle. So these 2, they found out that they are both carriers. All right, both carriers. I probably misspoke earlier. That's why you answered 3 this time. Excuse me. I probably misspoke. Okay. And so what I said earlier about the 50 chance is that with the different with the group here, let me go back into that slide. What I meant about the 50-50 chance here, it's because of the possibility that they can get either the son number 1, or here we're referring to the second picture right now in figure number 2. So for example, both are carriers, right? The mother and the father. So there will be a chance that one of the offsprings will actually develop that sickle cell disease. Okay? So this is what I was referring to earlier. However, one of the daughters or maybe one of the sons here could possibly inherit one good gene from each of the parent, which is shaded in blue, and one bad gene coming from either the father or the mother. So we will see here the 2 children with the red and the blue shades. They're actually just carriers. They're not going to be they're not going to manifest the SCD, okay? There's only this girl that has the full red shade, which basically got the defective genes from the father and one defective gene from the mother, okay? So let's go back into our question. Where are we at? Are we here? Yeah. So let's go back into the question. What should the nurse consider when planning follow-up counseling for James and Lisa regarding their genetic testing? 1, their child has a 25% chance of having sickle cell disease. 2, they both have a higher risk of developing sickle cell disease later in life. 3, each of their children has a 50% risk of developing sickle cell disease. And 4, the risk for their children depends on a mix of genetics and lifestyle. Okay, good thing. I'm seeing 1 right now. So the correct answer here is 1. Their child has a 25% chance of having sickle cell disease, as we know that this is an autosomal recessive inheritance, right? Autosomal recessive, which simply means that both parents, right, are carriers. We have James and Lisa, they're both carriers. And so there is a huge chance that one of the offsprings will really get both defective genes, and maybe one of the children will not get any of the defective genes. So they're free from any sickle cell trait or not even a SCD person. And so this simply means that if both of the parents are carriers, so let's put here parent, carrier, okay? There is going to be a 25% chance that with each pregnancy, their child will probably inherit the sickle cell disease gene from both parents, okay? Again, there is 25% chance that with each pregnancy, their child might inherit the defective gene. So, I'm shading this one right here. Each parent will have the defective gene. So again, 25% each pregnancy. There is that risk that that child will become defective, getting both bad traits. Okay, what about number 2? They both have a higher risk of developing sickle cell disease later in life. No, that is incorrect, because as we know that carriers, those people that have only one sickle cell gene, will not develop any sickle cell disease. All right, so this is wrong. What about number 3? Each of their children has a 50% risk of developing sickle cell disease. Again, each of their children has a 50% chance of developing sickle cell disease. Well, remember that inheriting one sickle cell gene does not necessarily mean that they can develop. So this is also a wrong statement. What about 4? The risk for their children depends on a mix of genetics and lifestyle. Again, let's go back into the concept. The risk of inheriting the sickle cell disease is purely genetic, not lifestyle. This is wrong. Okay? It is only genetic. So this is an incorrect statement. So our correct answer here is number 1. Let's go to question number 9. A 40-year-old African-American woman with chronic pain due to sickle cell disease has developed a tolerance to her usual pain medication. The question states, a 40-year-old African-American woman with chronic pain due to sickle cell disease has developed a tolerance to her usual pain medication. When does the tolerance to pain medication become most problematic for this patient? Emily is the patient. For some reason, I started removing the names earlier this morning because I thought maybe I need to remove, and I forgot to remove the rest of the name. So basically, that is the patient that we're talking about. So what is in option number 1? When it leads to inadequate pain relief, what does that mean? But before we go to do that, let's eliminate the others because that actually is the correct answer. Okay, let's have number 4 instead. When her family worries about increasing her dosages. I know family would be important if they are concerned about the patient, especially that there is tolerance. It's said that the patient has developed tolerance, and this is expected, guys. This is expected. It's not a hearsay. You will find this out once you will be taking care of so many sickle cell disease patients. It's not easy to deal with them because you probably would be misled that they are addicted, that they are just malingering. No, the pain is subjective, guys. You cannot assume that their pain is not real. You cannot do that as a nurse. So again, like I've said, the patient in the scenario has developed the tolerance to the usual pain medication. I know family is part of the patient care plan. So we always want to make sure that they understand also the treatment. And so when we are talking about this, when does the tolerance to pain medication becomes most problematic for Emily? Do you think that 4 would contribute to that when her family worries about increasing dosages? Would that really be the most reason, or is this going to be the ultimate reason that there will be a problem in the therapy, the pain medication therapy? Maybe at some point, yes, or maybe at some degree, to some degree, the family concerns will probably have a certain kind of like weight, especially in the administration of pain medication, but this isn't the ultimate reason. So we are going to eliminate that. What about number 3? When needing to report her addiction to her doctor. When needing, well, guys, tolerance is not equating to addiction. These are 2 different things. No, it doesn't. Tolerance does not equate to addiction, and it simply means that the medication is actually less effective over time. Medication is less effective, and this is expected, guys. And this is true in pharmacology. Okay? This is what we refer, I believe, as tachyphylaxis. Okay, number 2. When withdrawal symptoms appear. What does that mean? When withdrawal symptoms appear? Well, this can occur when the medication is suddenly stopped. Can occur when the medication, when the opioid, because we are talking about like the usual pain medication, right? For pain, opioid med is suddenly stopped. But it's not about the tolerance, okay? It's not because of the tolerance. So we're going to eliminate that one. So we are with number one, right? We don't have any other choice when it leads to inadequate pain relief, right? Like I have said, the tolerance can develop over time and the medication will no longer be effective. Okay, so definitely this is going to be the most problematic scenario for this patient. And again, our role here as nurses is to carefully assess the pain level of our patient. Do not assume that the patient is malingering, or don't make false assumptions about this patient. Never. The pain is subjective in nature and we need to deal it accordingly. So objective assessment. I mean, you gotta deal with it objectively, not like just assuming that, hey, this is a patient that is probably addicted to the medication. No, you're not gonna effectively treat this patient if your mindset is like that. Okay, so our correct answer is number one. Number 10, a nurse is caring for a 30-year-old patient with a sickle cell disease who has been prescribed hydroxyurea. As part of your patient education, you need to ensure the patient understands the drug classification, the possible side effects, and key points about their therapy. All right, so what is your task here? Based on the scenario provided, you're supposed to complete the bow tie diagram below by selecting the correct drug classification. And also you're going to have to supplement that with the 2 side effects and 2 statements of understanding about the therapy. Okay, so you have your options for the side effects, you have the option for the drug classification, and you have the options for statements of understanding. Very good, Jet. That is the correct answer. That is the disease modifying drug or agent. As I have said earlier, in some cases, let's say it can be used as an anti-metabolite. It can also be used as an anti-neoplastic agent. But for this patient, it is classified as a disease modifying agent. And so that is the correct answer. Okay. Disease modifying agent, that is the correct answer. Now, well, again, the hydroxyurea will what? It can alter the course of the sickle cell disease. It can increase the production of fetal hemoglobin. Increases fetal hemoglobin. Aren't you curious why it's called fetal hemoglobin even though the patient is adult? Yeah, I was curious about that too, and I can't find the answer really. I mean, yeah, it could be. I just probably did not investigate further, but it can cause an increase in the fetal hemoglobin. Now, what do you think are the side effects? Here are listed. Nausea, vomiting, increased risk of infection, hypertension, hair loss, hyperglycemia. So what do you expect about the side effects here, guys? What are the side effects that you will anticipate developing in this patient? Take a look. Is that nausea, vomiting, increased risk of infection, hypertension, hair loss, hyperglycemia? Okay, patient statements 2 and 3. Okay, what about the side effects, guys? I haven't seen you answering that question yet. What do you think are the side effects? 2 side effects. Is it nausea and vomiting? Is it increased risk of infection? Is it hypertension? Is it hair loss? And is it hyperglycemia? Signs of infection, risk of infection, hypertension. Okay. Well, the correct side effects for the hydroxyurea will be, one is the nausea and vomiting, and the other one is increased risk of infection. Okay, why nausea and vomiting? This is identified as the most common side effect. Top in the list, most common. And the increased risk of infection, the reason why it can do that, it's because of the bone marrow suppression. So that is why we need to keep an eye on this patient's blood count. So remember that I said earlier about regular checkups on this patient, that they need to be compliant with the visits when they are prescribed with the hydroxyurea. The reason for that is because they need their blood work checked every now and then. And in some cases, it will be done at least every 3 to 4 weeks. Okay? Frequent or regular CBC check. Okay? It can lead to bone marrow suppression. It can decrease the white blood cell count. It can also decrease their platelets and also the red blood cell. So it has that kind of paradoxical effect to some degree, but overall it will increase the fetal hemoglobin, which is basically the problem in the sickle cell disease. Okay, so take a look into the bone marrow suppression, which can lead to their increasing risk of infection. Now let's answer about the correct statements. What do you think would be the correct statements here? Oh, before we go to the others, what about hypertension? Do we know of hypertension as the side effect? No, it's not a typical side effect of hydroxyurea. Hair loss is not a side effect either in the hydroxyurea, but hair loss can be a side effect in other anti-neoplastic agents, but not hydroxyurea. What about hyperglycemia? Increase blood sugar level. That is also incorrect, and it is not a typical side effect of hydroxyurea. Hair loss, hypertension, hyperglycemia aren't known side effects per literature. Now, looking into the statements of understanding, what do you think would be those statements? Well, one of those would be hydroxyurea helps to increase fetal hemoglobin levels in my blood. So that is one, like I've said earlier. And the other one is regular blood tests are needed to monitor my response to hydroxyurea. So if you answered, I should stop taking the hydroxyurea if I start feeling better, this is incorrect. The patient should be taking the drug regularly. Okay. What about this one? Hydroxyurea will cure my sickle cell disease. It doesn't cure. It is a preventive treatment. Preventive TX treatment. So it doesn't cure. What about this one? I should avoid drinking plenty of fluids while on hydroxyurea. No, you're not supposed to avoid. The patient should be taught to increase their fluids again to prevent the vaso-occlusive crisis. We want to dilute their blood with fluids in order to prevent vaso-occlusive crisis. How did we do here, guys? Did you get more correct answers in this bow tie? I like bow tie. I like bow tie myself. Moving on, number 11. Okay, before we're going to move on, again, I'm reminding everyone to enroll to our NCLEX RN course at our website. So kindly visit at www.stancoastandclexcoaching.com, and please check out the description box below to get some more details. So please enroll as early as now. Okay. Bad? Why is it? Moyo, Miss Moyo, Charity, 4 out of 5, 4 out of 5. Not bad. Not bad. Not bad at all. Let's move on, guys. Question number 11. A 35-year-old male patient with sickle cell anemia receives frequent blood transfusions. What complication should the nurse monitor Lucas, here again, I forgot to remove the name, for what should the nurse monitor Lucas for due to his regular blood transfusion? Is it 1, low blood volume, 2, vitamin B12 deficiency, 3, low platelet count, and 4, iron overload? I think we have already answered this one earlier, but I just want to measure or gauge if you still recall. Nani Hampo answered 4, iron overload. So let's take a look into the scenario. 35-year-old male with sickle cell anemia receives frequent. Just the word frequent is your clue. If the patient is getting a lot of blood transfusions, again, iron content in the blood transfusion can lead to iron overload. So this is our correct answer. This is an easy question. Iron overload. Okay. Again, the body has no other natural means of excreting excess iron. And so this can damage the liver and the heart. Potentially can damage the heart and the liver. All right. What about number 1? Low blood volume. Low blood volume. Do you think that their blood volume will be low if they are frequently getting the blood transfusion? I doubt. So this is wrong. What about vitamin B12 deficiency? Well, we know that vitamin B12 deficiency is not associated with the blood transfusions, frequent blood transfusions, so we're also eliminating that one. What about low platelet count? We don't have an issue with thrombocytopenia in this disorder, okay? It's not a consequence in the frequent blood transfusion. So we're going to remove that as well. Very easy question. Number 12. A 22-year-old African-American woman with sickle cell disease is being treated for a sickle cell crisis on the medical unit. The nurse notes that Jessica, who is the patient, has developed a fever and new lung crackles. Lung crackles. This is the patient. I forgot to remove the name. A 22-year-old African-American woman with sickle cell disease is being treated for sickle cell disease, is being treated for a sickle cell crisis on the medical unit. The nurse notes that Jessica has developed a fever and new lung crackles. What should the nurse do first upon noting Jessica's fever and lung crackles during her sickle cell crisis? Do you think 1, start supplemental oxygen via nasal cannula? 2, administer bronchodilators by nebulizer? 3, consult with a respiratory therapist about high flow oxygen? Or 4, notify the primary care provider about a possible infection? And I think we already emphasized this one earlier, so good job, guys, for answering 4. This is the correct answer. The signs of fever right here is already a medical emergency. The lung crackles. Signs of infection is a medical emergency in sickle cell disease. Okay, I'm emphasizing that right now. Again, in sickle cell disease, a regular fever is already a medical emergency. Not on any other patients, but here in a patient with sickle cell disease, a fever is a medical emergency because it can lead to the sickle cell crisis. And I cannot emphasize more than that. All right? It's very important to treat the fever. We need to notify the medical provider right away. Don't delay, guys. This is a matter of life and death, because once they go into that sickle cell crisis, they can go into that vaso-occlusive. It's gonna impair the overall functioning. It can probably lead to stroke, heart attack, maybe thrombosis into the kidney. and the joints. There's so many things that can potentially happen to this patient. And so we need to deal with that right away by hydration with IV and the management using pain controls, okay, or the pain relievers. Now, if we had answered supplemental oxygen via nasal cannula, it's not really going to primarily direct the main problem here. It's not, okay? Although we can provide them with oxygen along with the other interventions, but our main goal here is to notify the medical provider so that we can get a much more comprehensive therapy to obtain comprehensive treatment. That is the goal here. Because if we're just doing number one, supplemental oxygen, it's not really going to treat the overall picture of our patient. What about number two, administer bronchodilators? It's not going to treat the other manifestations that could possibly happen. Consulting with a respiratory therapist, same thing. It's not going to address the pressing issues that might occur in this patient in a matter of a short time. So notifying the medical provider is of utmost priority. It's very crucial, guys. Number 13. A 21-year-old African-American male with sickle cell anemia is receiving education on how to prevent future sickle cell crisis. What preventive measures should the nurse recommend to Liam, who is the patient? Again, I forgot to remove the name, to help avoid a sickle cell crisis. Is it 1, use preventive antibiotics and maintain good hygiene? 2, increase physical activity and take over-the-counter iron supplements? 3, reduce stress and follow a high-protein diet? And 4, avoid cold temperatures and stay well hydrated. Okay, let's eliminate the items. If you had answered number 1, while the patient is taking preventive antibiotics, maintain good hygiene, is this going to be necessary? Preventive antibiotics? Not routine treatment, okay? We don't see this as a routine treatment for a patient. It's only going to be given if the patient has an existing infection. Wrong. Only indicated with existing infection. 2, increase physical activity and take over-the-counter iron supplements. Now we have iron again. Can potentially cause iron overload. We don't want that. What's going on with my handwriting? Iron overload. If there is no definitive diagnosis that the patient has iron deficiency anemia, then there's no need for us to advising the patient to take any of a iron supplement. There's no need, okay? We're only going to offer the iron supplementation only if the patient ends up with iron deficiency. That's the truest statement. Okay, let's answer, let's have 3. Reduce stress and follow a high-protein diet. Reduce stress. Yeah, we know that this is very beneficial, but a high-protein diet is not specifically required to prevent sickle cell crisis. Okay? Not indicated. It's not going to really prevent any sickle cell crisis. What about this one? Avoid cold temperatures and stay well hydrated. As we know, it can lead to what? Vasoconstriction. And the statement, or let's say staying well hydrated, it can prevent vaso-occlusive crisis. All right. So that's it for number 13, guys. Yeah, our intervention here, or the nursing actions here, are pretty much repetitive, but I hope that this is kind of helping you retain really the important actions and the rationalization here. It's very good to repeat things until it gets registered into your subconscious. Item number 14, a 25-year-old African-American male with sickle cell disease discusses his treatment regimen with a nurse. Which statement by Kevin, who is the patient, suggests he needs more education about managing his sickle cell disease? Let me reread. A 25-year-old African-American male with sickle cell disease discusses his treatment regimen with the nurse. Which statement by the patient suggests he needs more education about managing his sickle cell disease? Is it 1, I should avoid traveling to high altitude locations? 2, smoking can trigger a sickle cell disease? 3, I need to drink 4 to 6 liters of fluids each day? And 4, taking a baby aspirin daily can help prevent a sickle cell crisis. What do you think, guys? For number 14. I need to hydrate before I'll end up with a sickle cell crisis today. Just kidding. Needs more education. Needs more education. So if you're not sure, again, use the elimination process. Let's start with number 1. I should avoid traveling to high altitudes. Remember, in high altitudes, there is low oxygen concentration. Low O2 concentration. So our patient should not be vacationing into the mountainous regions like the Aspen or the Swiss Alps. Nope. They should not go there, because the more that they're going to expose to low O2 concentration places, they're going to end up with a vaso-occlusive crisis. No, they should avoid. What about 2? Smoking can trigger a sickle cell crisis. We know that this can lead to vasoconstriction, right? Vasoconstriction, which can also decrease the blood flow to the organs, right? Yeah. This is going to lead to a vaso-occlusive crisis. So this is a good statement. So we are eliminating that one. What about number 3? I need to drink 4 to 6 liters of fluids each day. Are you this person that drinks 4 to 6 liters of fluids each day? Because I am that person. I can consume 1 liter of fluid in just in one setting. Yeah. Need to drink 4 to 6 liters. This is one of the good interventions, especially in this patient with the sickle cell disease. They need to dilute their system. So this is a good action. We are eliminating that one. Good statement, rather. So taking a baby aspirin daily can help prevent sickle cell crisis. There's not such a thing that the aspirin can prevent the sickle cell crisis. It's not. Okay? It is an antiplatelet medication, but will not prevent the sickling of the red blood cell. It is an antiplatelet, but it doesn't fix abnormal red blood cell. Okay? Oh, thank you, virtuous lady. I'm glad that I'm being helpful. Thank you so much. You made my day. All right. So, again, please focus into the elimination if you're not quite sure, guys. It will definitely help out. If you're not familiar with the mechanisms, try to do the elimination process and weigh things carefully. Okay? Because of course, not everyone would know everything, right? That's impossible. So sometimes you're just going to encounter a question that you're not aware of. Maybe you haven't even read about the disease process and you'll be caught unaware. You'll be like, what is this question? And yeah, you just have to face that test question and try your best. Try to eliminate those choices that you think would not fit into that question or will something that could harm. So here's my technique, guys. You're going to eliminate those choices that can harm the patient. This is my technique. Something that can harm the patient, something that can delay the treatment, and something that will not address or does not address the ABCs if the patient is already compromised in their ABCs. Okay, so here's my technique for you guys. I hope this will work for you. Again, if you are not sure of your answers because you are not familiar with the disease process, you're going to eliminate those choices that can harm the patient, eliminate those choices that can delay the treatment. If you already know that, hey, looks like there's already enough assessment findings in the scenario. Do I still need to do some more assessment if it's already sufficed to intervene? Then probably you need to do something about that problem, pressing issue immediately. So for those treatments or choices that can delay the treatment, there's a possibility that they are supposed to be eliminated. And those choices that can does not address the ABC. If the patient is already compromised in their circulation, if their breathing is already compromised, their airway is already compromised, and if that choice is not addressing that, then eliminate that one. Okay, this is very important. Now let's move on to number what do we have here? Number 15. A 19-year-old African-American female with sickle cell disease presents with severe abdominal pain. What is the nurse's priority intervention for Ashley? Here we go, another patient. Severe abdominal pain. Would that be 1, obtaining a detailed history of her symptoms, 2, keeping her NPO, 3, administering IV fluids, 4, preparing her for an abdominal CT scan? Let's take a look. A 19-year-old African-American female with sickle cell disease presents with severe abdominal pain. What is the nurse's priority intervention for Ashley's or the patient's severe abdominal pain? Is it obtaining a detailed history of her symptoms, 2, keeping her NPO, or 3, administering IV fluids, 3 or 4, preparing her for an abdominal CT scan? Well, that kind of woke me up this time. What do you think would be the priority intervention? Severe abdominal pain. Severe abdominal pain, guys. What is the nurse's priority intervention for Ashley's severe abdominal pain? This could be a very life-threatening manifestation that you need to really keep an eye on. Okay? So it looks like all the interventions here are actually good interventions. You just need to prioritize the high or the most appropriate, the critical action that you should give or that you should perform for this patient. Okay? What do you think? Severe pain. Looking into the answers, I'm seeing so many 3s. There are 2s. There's 1, or if there's several 1s. Okay. Priority intervention or action, nurse priority intervention for severe abdominal pain. Let's eliminate first. Let's start with number 4. Preparing her for an abdominal CT scan. Yeah. So before we can do this preparation for a CT scan, yeah, I know that we can get some very important information when we have a patient undergoing a CT scan, right? Yeah, so many impressions that can be derived by the imaging, let's say the radiologist or whoever is going to read the result, right? It can give us a better diagnosis, right? Or essential information about the patient's well-being. But before we are going to prepare for abdominal CT, we're going to have to do history taking. History assessment is important. Okay. Yeah, we need to know what is the indication as well. Before the doctor can order a CT scan, they need to know the reason. Why are we going to order the CT scan? For what reason? Are we just doing this for like compliance? No, we need to know the reason why it is indicated. Okay, so the reason or the purpose of the testing should be established first. And this is going to be done by history assessment. That is very important. Number 3, administering fluids. Yeah, this is a very important nursing action as well. We definitely need to administer IV fluids. But before we are going to do that, we have to do thorough assessment. Right? Don't forget about thorough assessment before we're going to give them the fluids. Yeah, everything here are important. Everything, all the interventions here are important. What about number 2? Keeping her NPO. Well, it is also important, guys. If there is a possible surgical procedure, okay? If there is anticipated surgery, then we're gonna place the patient on NPO. But again, this will not place priority this time. We need to investigate about the patient's severe pain. What is going on with our patient? Is this caused by a possible rupture of the blood vessel? Or it could be a caused by an infarct of one of the organs because of the thrombosis. Okay? Because of the vasoocclusive problem. Vasoocclusion. We need to know first about the history of her symptoms. This is the first nursing action that we should be doing. Okay? Now the scenario itself really emphasized about the severe abdominal pain. We need to investigate further. We need to ask the patient, how long ago did you start having this pain? How bad is it in a scale of 1 to 10? What is the characteristic of your pain? Did it come like a knife-like sensation? Was it sudden? Was it abrupt? Was it a gradual pain? So make sure you do that assessment first. That is a correct answer. Okay? That is a priority before we can go further in administering all the other interventions. I said everything will be done after we have thoroughly assessed our patient. Next, and I think this will be our last for the day, a 27-year-old pregnant African-American woman with a sickle cell anemia is experiencing a sickle cell crisis. What treatment does the nurse anticipate as part of Melissa, which is basically the patient? Tomorrow, I'm not going to put any more names in my patient. What treatment does the nurse anticipate as part of Melissa's aggressive management for a sickle cell crisis during pregnancy? Is it 1, antihypertensive agents, 2, diuretic agents, 3, IV fluids, and 4, acetaminophen for pain? Our patient here is a pregnant African-American woman with sickle cell anemia, experiencing sickle cell crisis. Yeah, already in a crisis, guys. So what treatment does the nurse anticipate as part of Melissa's aggressive management for a sickle cell crisis during pregnancy? Let's filter the answers here. Let's start with number 1, antihypertensive drugs. Do you think this can address the sickle cell crisis? I doubt. There is no indication. We don't have an information. Patient is not hypertensive. We don't have that data. So there is no need for us to give any antihypertensive medication. We always need to know an indication of a medication. If you don't know the indication of a drug, do not administer that medication. Always start with knowing the purpose of administering the medication. If you don't know, don't give it. Be careful with yourself, guys. Do not administer any drug without knowing the indication. 2, diuretic agents. Do we have an information here that the patient is fluid overloaded? No. Patient does not manifest signs and symptoms of fluid overload. So we are seeing administering diuretic agents. We don't see that. There is no indication. No need to administer Lasix. No need to give thiazides. None. Null. Number 3, IV fluids. Do we need to have IV fluids? Of course. Crisis, guys. We have our priority. Circulation issue. Our problem in SCD is circulation, vaso-occlusion. That is a priority problem that we need to address. We need to dilute the blood. Make sure that you increase hydration. That is our goal. We need to do that. Because if the mother will not get adequate hydration, what do you think will be the blood supply to the fetus? Yeah. Fetal blood supply will be compromised as well if we are not going to deal with the hemoconcentration, or let's say the vaso-occlusion. So we need to give them IV fluids to prevent hemoconcentration. We need to address that, guys. What about number 4, acetaminophen for pain? Yeah, we can do that at a later time as indicated. If the patient needs it for headache or for some minor or mild pain, go ahead and do that as prescribed. But for a patient in a crisis, deal with the prevention of the vaso-occlusion, or let's say preventing more complications. Our issue here is circulation. So we're going to treat them with IV fluids. Eliminate that, and that's one as well. Okay? Alrighty, guys. Again, we are inviting you to enroll to our NCLEX course at a website. So stop by at www.stancoast@clexcoaching.com and also take a look into our description box below where you can get some more information. And thank you so much for your participation today. I hope that you are learning about this concept. I know it's kind of like so extensive, but this is how I present my topic to my students. I just don't do light discussions without letting them to really go deep into the concept. That's how I want my students to have when I'm giving them the lectures, not just very light discussions. And so if you are benefiting from this discussion, please hit the like and subscribe button if you haven't yet. And so we'll see you again tomorrow at 9 p.m. Eastern Standard Time. And we will be talking some more about I believe, hematology still, and also the circulation. Yeah, we still have to talk about the different types of shock. And this is a priority concept that needs to be discussed as well, because this is one of the high yield topics in NCLEX. So we're going to need to delve into that, but I'm not quite sure if this will happen tomorrow, but definitely we're going to tackle that one as well. So again, thank you, and you have a great day. Take care, everyone. Bye-bye.